Mr. Jim Weeks. Jim is a certified industrial hygienist who has worked on occupational health and safety problems in the mining industry since 1983. He has over 50 publications in the peer-reviewed scientific literature and is senior editor of Preventing Occupational Disease and Injury, published by the American Public Health Association. He has served on many advisory committees, including a panel of the National Academy of Sciences to evaluate NIOSH and their mining programs, and MSHA Advisory Committee on respirable dust. He received an engineering degree from the University of California, Berkeley. He's a Doctor of Sciences that he received from the Harvard School of Public Health.
Chairman Wilson and other members of the committee, my name is Jim Weeks. I'm a consultant industrial hygienist appearing today on behalf of the United Mine Workers. Congressman Wilson noted earlier that I'm also a member of the technical study panel investigating the issue of the use of belt air that was mandated by the Miner Act. And I should be clear today that I'm appearing on behalf of the United Mine Workers and not in any way as a member of that technical study panel. I discussed this matter with the ethics officer at the Department of Labor and received those guidelines from him. Anyway, thanks for inviting me to testify, but more important, I wish to thank you for providing the leadership to improve the health and safety of miners. Mining, unfortunately, in the United States remains the most dangerous industry in the United States, and worldwide, mines in the U.S. remain the least safe of mines in advanced industrial countries. So there is lots of room for improvement. I wish to speak to two aspects of the proposed legislation. First, the revision of the dust standard from 2 milligrams to 1 milligram for a 10-hour work shift. And second, use of the personal dust monitor, the PDM, for measuring exposure to respirable dust. Over the past 5 years, there have been several clusters of black lung cases identified amongst miners that started their mining careers well after the 2 milligram standard became effective. Many of these cases were of the more advanced form, progressive massive fibrosis, or PMF. This is a condition that is the most serious form. It allows for an automatic entitlement of benefits under the federal black lung program for total disability. Miners with PMF suffer and die early. There's no cure. We don't know the names of these miners. We don't know the mines where they worked. There's no specific event that caused these tragedies. But these cases occurred because of exposure to too much dust day after day after day over decades in a kind of slow-motion tragedy. These cases resulted from systemic failure. Before black lung kills, it tortures its victims with breathlessness and suffering. These lives will not end with a bang, but with a whimper, and it's all entirely preventable. These cases did not occur because we, and by we I mean the entire industry, operators, the union, miners, NIOSH, MSHA, equipment manufacturers. The cases did not occur because we don't know how to control dust. Effective and feasible dust controls are well known and are available throughout the industry. It was the failure to use these controls and the failure to enforce dust exposure limits, not the absence of knowledge, that caused these cases. In 1995, NIOSH recommended that the dust standard be reduced from 2 milligrams for a work shift to 1 for a 10-hour work shift. This recommendation was based on a comprehensive review of the scientific literature concerning coal workers' pneumoconiosis and other health effects, and was based on data gained from mines and miners in the United States over the past 30 years. The previous standard was based on research done in the United Kingdom and had to be adopted to the present situation. The study is scientifically sound. It was thoroughly reviewed by NIOSH and by external reviewers. It was also reviewed by the MSHA's Advisory Committee on Dust Control, which recommended that MSHA consider revising the dust standard based on the NIOSH criteria document. There are several important technicalities in the proposed legislation, which I'll just discuss briefly. First, the 1 milligram limit is expressed as a 10-hour average. The current 2 milligram limit is an average over a shift. Miners now work longer shifts, and when they do, they inhale more dust. Consequently, it's appropriate to adjust the exposure limit for shift length. Let me now turn to the personal dust monitor. I first became involved in mining dust issues in 1978, and at that time, there was a direct reading instrument being considered. 30 years later, it's the same instrument, and it's nowhere close to being implemented. The PDM provides real-time data at the time and the place where it is most useful. Under the current system, dust data arrives 1 to 2 weeks after the sample is taken. And during that time, conditions change. It's impossible to find out what exactly might have caused an overexposure. But with the PDM, we can identify when and where and why overexposure occurred. One of the important benefits of the PDM is that by identifying dust sources in a timely manner and with precision, it makes it entirely feasible for mine operators to identify and reduce exposure to below the 1 milligram limit. I should note that, I see my time is nearly up, but I should note that the union and a group of mine operators have been meeting over the past couple of years to try and find common ground so we could support the use of the PDM. We've agreed on a number of important areas. And these are that MSHA should do all compliance sampling, which is consistent with what this legislation says, that the PDM should be the single approved instrument for measuring dust, and that MSHA should purchase the samplers and mine operators maintain them. There have been important changes over the industry in the past several years, and I think the current technological environment allows us to take advantage of them. I'd be happy to answer questions